Before I jump into this lecture, I wanted to give you guys a heads up that we'll be talking a little bit about suicide. If you need to step away from this lecture for a bit, that's okay. This week, we'll be going over psychological disorders. A psychological disorder is a syndrome or collection of symptoms marked by a clinically significant disturbance in an individual's cognition, emotion regulation, or behavior. Such thoughts, emotions, or behaviors are dysfunctional or maladaptive, interfering with normal day-to-day life. Distress often accompanies such dysfunction. History has not been kind to those with psychological disorders. Throughout history, there have been three general theories of etiology of mental illness: supernatural, somatogenic, and psychogenic. Supernatural theories attribute mental illness to possession by evil or demonic spirits, displeasure of gods, eclipses, planetary gravitation, curses, and sin. Somatogenic theories identify disturbances in physical functioning resulting from either illness, genetic inheritance, or brain damage or imbalance. Psychogenic theories focus on traumatic or stressful experiences, maladaptive learned associations and cognitions, or distorted perceptions. We'll talk a bit more about the history of treating psychological disorders when we cover Chapter 16. Today, we understand psychological disorders primarily through two lenses. The first is the medical model. The medical model focuses on the idea that a disease, so in this case, a psychological disorder, has physical causes that can be diagnosed, treated, and in most cases cured through treatment in a hospital. So we diagnose a mental illness based on its symptoms. We then treat it through therapy, which might include spending some time in a psychiatric hospital. Many of today's clinical psychologists work in medical hospitals and collaborate with physicians to determine how the mind and body work together. The other lens that we look through is the biopsychosocial approach. Biology, psychology, and social cultural influences work together to influence our behaviors, thoughts, and feelings. This approach emphasizes that mind and body are inseparable. Negative emotions can trigger physical illnesses, and vice versa. The cultural influence is particularly interesting. Some cultures do not experience psychological disorders that other cultures may experience. For example, susto can occur in Latin American cultures. This is severe anxiety or panic in response to emotional trauma or fear of black magic. Eating disorders like anorexia are more common in food-abundant Western cultures. In psychology, when we classify people, we attempt to order and describe their symptoms. A diagnostic classification also helps us predict the disorder's future course and suggest appropriate treatment. In many countries, the most common tool for describing disorders is the American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorders, now in its 5th edition. This is basically the go-to for psychological disorders. While labeling someone, it can help us identify treatment options. It can also cause some problems. Labels can be self-fulfilling, and if negative, they can cause stigmatization. The stigma of mental illness can cause people to hide their symptoms and avoid seeking treatment. Okay, so we're going to jump into one of the heaviest topics of this class. Before we do, I just want to point out some resources. On this slide, you'll see the Suicide Prevention Hotline number. This is one of many hotlines that you can access if you need help. Each year, about 800,000 people complete suicide. People don't usually attempt suicide while in the depths of depression, when energy and initiation are lacking. The risk increases when they begin to rebound and become capable of following through. Comparing the suicide rates of different groups, researchers have found that Russia has double the rate of the US, and the US has double that of Spain. Within the United States, whites and Native Americans die by suicide about twice as often as Blacks, Hispanics, and Asians. Women are much more likely than men to consider or attempt suicide. However, men are twice as likely to actually die by suicide. This is because men typically choose more lethal weapons. Those with OCD are at a higher risk of depression, which increases their risk of suicide. perfectionism may also be a risk factor for suicide. Those who complete suicide typically are older, with the highest rate occurring to those over 70. Older adults may choose death as an alternative to current or future suffering, a way to switch off unendurable pain and relieve a perceived burden on family members. Suicide is also much higher among the rich, the non-religious, and the unmarried. Gay, transgender, and gender nonconforming youth facing an unsupportive environment, including family or peer rejection, are also at increased risk of attempting suicide. Negative emotion tends to go up midweek, so 25% of suicides occur on Wednesdays. Suicide rates are highest in April and May. One reason for this may be that when the weather improves, but a person doesn't feel any better, then they may feel more despair and hopelessness. If a friend or family member is talking about suicide, you can listen to them and display empathy. You should also connect the person with resources like the Counseling Center or the Suicide Prevention Lifeline. You can also try to protect someone who appears at immediate risk by seeking help from a doctor, an emergency room, or 911. Individuals with psychological disorders may be more likely to hurt themselves, but are they at risk of harming others? Most violent criminals are not mentally ill, and most mentally ill people are not violent. People with disorders are more likely to be victims than perpetrators of violence. Better predictors of violence are alcohol or drug use, previous violence, gun availability, and brain damage. Mental and addictive disorders affected more than 1 billion people globally in 2016. In the US, 47 million adults, or 19% of the population, experienced a mental illness within the last year. This table shows what percentages of Americans reported having a psychological disorder in the past year. We can see that about 9% of people reported having a depressive disorder or bipolar disorder. About 3.5% reported having PTSD, and so on. Keep in mind that these are self-reported, so the actual percentages might be much higher. The US has the highest rate of reported mental disorders in the world. About half of the people with a disorder experience their first symptoms by the mid-teens, and 3/4 do so by the mid-20s. Among the earliest to appear are the symptoms of antisocial personality disorder, with a median age of 8, and of phobias, with a median age of 10. Alcohol use disorder, obsessive-compulsive disorder, bipolar disorders, and schizophrenia symptoms appear at a median age near 20. Major depressive disorder often hits somewhat later, at a median age of 25. This table shows us some of the risk and protective factors for mental disorders. Some risk factors include things like personal loss, stressful life events, caring for those who are chronically ill, and insomnia. Poverty is one predictor that crosses ethnic and gender lines. The occurrence of psychological disorder is 2.5 times higher among those below the poverty line. Some protective factors include things like effective parenting, social skills, exercise, and literacy. Okay, since this lecture was kind of heavy, I wanted to end it on an uplifting note with some positive statistics. While psychological disorders are fairly common and can negatively affect our lives, the American Psychiatric Association has found that 87% of American adults agree that having a mental health disorder is nothing to be ashamed of. This notion becomes more common as adults age. Furthermore, 86% said that they believe that people with mental health disorders can get better. The percentage of people who believe that those with mental health disorders can live normal lives is fairly high, and that percentage grows as people age. Overall, these statistics show that while psychological disorders may affect many of us, the stigmatization of these disorders isn't as common as it was in the past. As we have conversations about psychological disorders and mental health, our society grows more understanding and accepting.